Next on the Delaware Way, a crisis when it comes to primary care doctors and a unique program that helps veterans get six-figure jobs. This is the Delaware Way. Welcome to the Delaware Way. I'm Larry Menti. Delaware and other states across the country have seen a decline in general practitioners, and it's continuing year in, year out to the point where some people are talking about a crisis. Let's talk about solutions. Andrew Dahlke is the president of the Medical Society of Delaware. Thank you for being here, sir.
Well, thank you for the warm welcome, and thank you for letting me talk about this subject, because we really need to have more primary care physicians in Delaware. We need to have more primary care physicians in the United States, and we need to understand how this all happens so we can try to fix the crisis. There's a real doctor shortage in America.
We've all seen these, urgent care centers opening up and these clinics opening up to try to ease the pain that general practitioners are getting overcrowded. Yes. Is that a good solution?
No, because you really lose continuity of care, because you're going to be seeing somebody for a short 20-minute visit. It might be okay if you have a rash or something really simple, but if you have a chronic condition, COPD, congestive heart failure, something that you need to see the doctor over and over again, you really need to build up that continuity. You can't have a different doctor changing your blood pressure medicine every week.
And oftentimes it's not a doctor, it's a nurse practitioner.
And though they are needed because of the crisis that we have to have ancillary care people other than doctors taking care of our citizens, because we don't have enough doctors.
Let me go back to the initial premise that the Clintons had in doing this. It goes against all economic theory with supply and demand. If you have more of something, usually the price goes down, not up.
Exactly. And there's a great gentleman named Buzz Cooper. Buzz was a oncologist. He was the dean of the Wisconsin Medical School, and he wrote an excellent book about the theory of poverty and healthcare costs. Okay, and the Clintons used something called the Dartmouth Atlas, and they looked at the cost of healthcare in Fort Collins, Colorado, and the cost of healthcare in Manhattan. And if you look at the per capita income in each place, at that time it was $35,000. But the cost of healthcare in Manhattan was 100 times the cost of healthcare in Fort Collins. And so they came to the conclusion that poverty really had no role in the cost of healthcare, which is, incredible.
And nobody's fixed this in all these years?
No, not yet. Buzz Cooper, when he wrote his book, he went along the A train in Manhattan, and he compared the cost of medical care per capita along by zip code on the A train. So you went from Harlem to the Upper East Side, and you could see how the cost of health care is really impacted by people who don't have any money. For instance, if you don't have your own cell phone and you get one of the, quote, free cell phones, there's only one number you can dial with that free cell phone, right? 911. So if you have one of those cell phones, you can get a ride to the emergency room, but you can't get a ride to a family practice doctor.
Well, let's talk about possible solutions. What do you see as a solution?
I think that we actually have to pay the family practice doctors what they're worth. We have an excellent physician at the Medical Society named Dr. Jim Gill.
Wait a second. So if you're going to pay them more than what they're worth...
No, you have to pay them what they're worth.
What they're worth. No, I'm sorry. I didn't mean to say more, but pay them what they're worth. That doesn't alleviate the problem of the mandate to cap the number of doctors.
Yes, it doesn't. But that's something that would have to be done on a national level, and I don't know if it's going to be, I would say it's too little too late. We've created the crisis, now we have to find a way to live with it, and it is not going to be an easy, quick fix solution. Right now we need to find a way to bring in family practice doctors and internists from out of state, and we can do that by paying more than the surrounding states. That would draw them in, by trying to ease physician burnout, so we can try to, milk the careers of the older physicians so they're willing to work into their 70s and 80s, which is what they're going to have to do to take care of the 70-year-old and 80-year-olds.
Is some of the problem compensation from the insurance companies?
Oh, that is a big problem. We got Senate Bill 227 passed last year, and previously the insurers were paying 65% and 85% of Medicare rates to the family practice doctors, and you cannot run a practice being paid less than Medicare rates. Medicare rates are really the bare bottom rates that a doctor can survive on. So you cannot pay nurses, you cannot pay office staff to work in your office when you're getting paid that low. And that's why all the doctors were either retiring, going to another state where the economic climate is better and they're getting paid 120% or 140% of Medicare, which is the standard rates around the country, not 65% or 85% of Medicare. So,
is this something the state has to do?
Well, the state can certainly help, and the state is helping because of getting Senate Bill 227 passed. That's the first step that they did. The second step is that they had multiple meetings in the last few months regarding how much to increase payment for primary care services. You see, for every dollar spent on primary care, you will decrease the cost of health care between $5 and $13 because you're taking patients into a low-cost environment from the highest cost environment, which is the emergency room and, inpatient hospital beds.
I'd hate to think of them as this Machiavellian, but do the insurance companies make more money once a patient leaves the general practitioner and starts going to the more expensive care?
Well, it is interesting. The Affordable Care Act had this part where they said that if you are a managed care organization, and that would be an insurer, and you collect premiums, you have to spend 85% of the premium on health care coverage costs, and 15% can be used for overhead and profit. So that kind of capped them, so if they lower the cost of health care, they don't make any more money because they can only make 15% of their premiums. So if you're the CEO of an insurance company and you have to keep your job and you have a board of directors looking at your earnings statements, you really can only grow your business by increasing the total cost of care of medicine.
As we wrap this up, is there anything that's happening right now that people can get behind?
Well, right now I would say get behind Senator Brian Townsend because he's an excellent individual who's leading the charge on trying to fix the primary care dilemma in Delaware, and he's working in Dover, and he's done a great job. It's
not something that gets a lot of attention.
No, it's not something that gets a lot of attention, but we're working very hard on trying to find practical solutions to bring down the time that it takes to get an appointment with a primary care physician. Where I am in Sussex County, it can be 6 months if you're to find a doctor if you're a new patient. And the wait is incredible, and it's been underestimated in the study that came out. But I mean, they did their best with the numbers that they had, but the crisis is definitely underestimated by.
Wonderful. Thank you, sir. I appreciate you coming in. Andrew Dahlke is the president of the Medical Society of Delaware. When we come back, we'll find out what the Delaware College of Art and Design is up to when the Delaware Way continues.